Hey, Dave O'Sullivan here, and in this video I want to show you how to have more structure in your approach. So structure, essentially, when we look at it, it's just broken down into specific milestones, okay? So we can have structure with our subjective assessment, which is where we go through a process with the patient. With the objective assessment, we can have structure, but the biggest thing that I see missing is how to structure a rehab program. So when we look at a rehab program, we first always work backwards, okay? So we want to know where are we going, okay? Then we need to know where is the patient currently. And then how to structure that, it's just a case of filling in the gaps, okay? It doesn't need to be complicated. And what we want to do with that then is we just want to put in the milestones that the patient is going to need to hit in order to achieve the dream outcome, okay? So once we can do that, what's going to happen then is to get the patient to the dream outcome, it's going to feel a lot less overwhelming. Now, here's the biggest mistake that I see people make is that they actually start to design the treatment plan after the objective assessment. In order to have complete structure, we need to nail the subjective assessment because you're going to ask questions in the subjective assessment of what the patient needs and wants to do. And what that's going to allow you to do then is that's going to allow you to structure your objective assessment to assess where the patient is currently, okay? Then that's going to give you valuable information and it's actually going to show you where the gap is currently for where the patient is to where they want to get to, okay? And that's going to focus your mind and go, okay, this is where they're at, this is where they want to get that, this is what they need to do in order to be there. And all of a sudden then we've got a very structured program that's going to add a lot of value to patients' lives because we're actually going to be doing things and focusing on things that's actually meaningful to them and gives them value, okay? So when you put this in place and you get your structured step-by-step system in place, patients are naturally going to come back because they're hitting milestones and then know there's more milestones to be hit. But also your patient knows that there's more progress to be made in order to achieve the dream outcome because you're getting closer and closer and closer. So it's a bit like when you go on a car journey, you start and you can see the sign 200 miles away, 100 miles away, 50 miles away, okay? So when you get to 50, 25 miles away, you're not going to stop, okay? Because you're so close to the destination, you can feel it, okay? Your whole physiology changes, you start to relax a little bit, you start to get excited, okay? And that's the same thing that happens with the program, okay? So if you want more structure, it all starts in the subjective assessment and it all starts with actually understanding where we're getting the patient to. The objective assessment, we need structure to understand where they are. And then the explanation, we need to then fill the gaps. And then as we go into the hands-on treatment and the rehab, then we're just following that structured step-by-step system. If you want help putting together a structured step-by-step system, just drop me a comment in the comments below, say yes please, and I'll send you all the information or feel free to send me a message.